Hello and welcome to this video on peroxisomal malfunction. Broadly, peroxisomal diseases can be classified into two types: single peroxisomal protein deficiencies and peroxisomal biogenesis disorders. Within this category there are multiple different disorders. However, this video is focusing specifically on Zellweger syndrome spectrum, which is then broken down into three types: Zellweger syndrome, neonatal adrenoleukodystrophy, and infantile Refsum's disease. Mutations in peroxisomal biogenesis disorders can vary. When peroxins involved in peroxisomal biogenesis are mutated, correct synthesis and function of the peroxisome is disrupted. It has been identified that mutations can occur within 12 of the PX genes associated with the peroxisome, and this results in slight variety of symptoms experienced in the patient, as specific mutations will result in different symptoms. To date, hundreds of mutations affecting the PEX genes have been discovered, but the specific combination of mutations that occur in the PX gene of an individual are largely unique. The majority of defects occur in only 5 PX genes, including the following: 60% of defects in the PEX1 gene, an alpha amino acid required for peroxisomal matrix protein import, of which 2 common pathogenic variants have been identified; 16% of defects in the PEX6 gene, 7% of defects in the PEX12 gene, and 4% of defects in the PEX26 and PEX2 genes respectively. This said, patterns within particular populations have been observed. For example, in Japan, variants in the PEX10 gene, which is this one specifically, is recurrent within the population. A number of different mutations are possible, all of which are different types, including frameshift mutations, SNPs, indels, and nonsense mutations, to name a few. The inheritance of the different peroxisomal disorders are all of the autosomal recessive manner. This means that for the offspring to be a sufferer of the disorder, both parents must be carriers and both alleles inherited by the offspring must be of the defective type. Current research is trying to underpin cheaper and faster ways of testing patients and couples trying for a baby, which would allow couples to make a more informed decision about having a child. These tests would be able to sequence the whole PX gene sequence of the individual and would ultimately provide couples with a greater understanding of how their genes could affect their offspring. This could also help reduce the prevalence, which is currently at 1 in 50,000 people. The three types of Zellweger syndrome spectrum disorders have varying severity. Zellweger syndrome presents with the most severe symptoms. Neonatal adrenoleukodystrophy is an intermediate form, and infantile Refsum's disease has the most mild symptoms. Evidence that the Zellweger syndrome type is specifically the most severe when compared to the other two is identified when performing diagnostic techniques. The concentration of very long chain fatty acids in a Zellweger syndrome patient is more elevated than in the other two. However, the phytanic acid is much the same in all three, so cannot be used to distinguish between the three types. We're now going to look at the symptoms. Symptoms are numerous, and it can be difficult to diagnose a patient with Zellweger syndrome specifically because there is an overlap with other disorders also. This includes Usher's syndrome. Recognisable symptoms of Zellweger syndrome spectrum disorders include some of the following: hypertonia, seizures, feeding difficulties, vision and hearing loss, liver cysts, broad nasal bridge, high forehead, upslanting palpebral fissure and epicanthal folds, microcephaly and macrocephaly, protruding tongue, neck, skin folds, cataracts and glaucoma. Diagnostic techniques used to determine whether an individual is a sufferer of any of the Zellweger disorders includes analysis of these compounds extracted from the plasma or urine samples. It can be noted that the very long chain fatty acid concentration will be increased in patients, as well as the phytanic acid concentration. Plasmalogens will be severely diminished, and the picoic acid will be slightly increased, whereas bile acids will show an accumulation of the intermediates THCA and DHCA. Although the disorder can easily be diagnosed using relatively easily performed clinical methods, there are no current treatments to the disorders, so it is mainly management of symptoms that is attempted. Using a particular feeding type, this often involves fitting a gastronomy tube to allow easily regulated calorie intake at home. No particular diet is required, as most individuals are likely to reject a number of different food types anyway. Loss of hearing is overcome by fitting a hearing aid to the child. Loss of sight is overcome by removal of cataracts in early childhood, and appropriate glasses should be prescribed if necessary. Overcoming liver impairment usually involves taking vitamin K supplements and other fat-soluble vitamins. Additionally, primary bile acid therapy may improve liver function by reducing the accumulation of cholestanoic acids. And finally, neurological defects, including seizures, can be reduced by taking anti-epileptic drugs. However, these may not be particularly effective. Also, as well as these medications and possible surgery, genetic counselling is available to couples who are thinking of having a child. This allows them to make a more informed decision as to whether they really want to take the risk of having a child who may suffer of Zellweger syndrome spectrum disorders, who are likely to only live for a few months. Thank you for listening.